Hi, everyone. My name is Kaylee, and I'm presenting on my research titled From Healthcare Education to Practice, Achieving a Therapeutic Alliance Despite Language Discordance. To first frame the research project, I would like to call attention to the prevalence of limited English proficiency in the United States. This is defined as any individual who doesn't speak English very well. So the U.S. is home to 24 million adults with limited English proficiency, and 100,000 adults reside in Boston itself. This map on the left here shows the population density of individuals who speak limited English proficiency. And we can see with the dark purple, the higher population density of this population being Boston. And statistics show that 11% of all adults in Boston are limited English proficient. While this complicates daily living, this also proves to be extremely complicated in a healthcare setting. Successful patient care usually calls on the therapeutic alliance, which is defined as the mutual relationship between a provider and a patient that is grounded in both empathy and a shared decision-making process. This is usually defined when a provider and a patient can seamlessly talk together and work through their care. As such, it is complicated by language discordance. So my goal was to better understand how teaching the therapeutic alliance and empathy can contribute to how a provider practices. I decided to focus my research on the Boston University Sargent College graduate programs, including occupational therapy, physical therapy, and nutrition/dietetics. Within these programs, I was hoping to see how they teach the therapeutic alliance and empathy, specifically in situations of language discordance. For the beginning of my project, I called on the faculty and students within these programs. So one faculty member from each respective program participated in a semi-structured interview, and the students of all three programs were distributed a survey. These both asked questions from Likert scale, multiple choice, as well as short response in terms of the survey. And the semi-structured interview gave faculty a space to open up about teaching the therapeutic alliance, teaching empathy, and talking about language discordance. And both responses were then thematically analyzed to understand if what the faculty intend to teach is being received well by the students. So here are some examples of how I collected my data for the faculty that participated in the semi-structured interview. One of my questions was, how is the idea of the therapeutic alliance conveyed? Are there specific lessons, hands-on learning, or moments in the course when this is addressed? And then they were able to respond as they felt. One of the student survey questions, this one, for example, was a Likert scale question in which it first defined the therapeutic alliance, again, as the mutual relationship between a patient and provider that is grounded in empathy and a shared decision-making process. And then I asked them to rate their level of agreement with the statement, being that Sargent has emphasized the idea of creating a therapeutic alliance with patients. Then my advisor and myself went through all of the responses from both the faculty members and the students and coded them to umbrella terms of themes, and then further went through and created sub-themes. So for example, one of the questions that called for a short response in the student survey asked, can you explain your perception of how to apply empathy and a therapeutic alliance in a clinical setting? One of the quotes read, the biggest component of creating this alliance is showing empathy and being willing to listen to the patient. So this quote aligned with the theme of active listening and was seen repeatedly throughout other student responses as well. And then when looking at all of the responses that fell under the umbrella of active listening, there was a sub-theme of validation and empathy. And one quote that demonstrates that is, in therapy, true empathy requires practitioners to approach their clients with curiosity and assuming their experiences are valid while also maintaining enough objectivity to achieve therapeutic gains. So to wrap up the results part of that, each question that the students answered and also each interview that the faculty participated in ended up with like 5 to 7 themes. So this one question that we talked about, I identified the themes of professional skills, tools, and specific models, cultural humility and power dynamics, patient-centered care, and active listening. So then when comparing the results from the faculty to the students, there was both consistency and inconsistency. So in terms of the consistent responses, there was a clear definition and understanding of the therapeutic alliance. So the faculty outlined the curriculum, talked about how they incorporated this in their lessons and things like that, while the students recognized the term and also how they practiced it in their fieldwork, for example, and also the importance of it. In terms of empathy, the faculty cited this word multiple times throughout their interviews. They explained how they embedded this idea within their teaching, and especially within their teaching of the therapeutic alliance. The students also cited this word multiple times throughout their responses and illustrated the importance. The one overall inconsistency was in terms of language discordance. The faculty acknowledged that it was discussed in the curriculum, especially with their exposure during fieldwork, which students of all three programs participate in. However, students cited some disappointment and lack of discussion on formal training on language discordance and how they would approach that in practice. So to conclude, the ideas of consistency in terms of therapeutic alliance and empathy can serve as models that other graduate healthcare programs can incorporate into their curriculum, as students were receptive to it and successful at putting these concepts into practice. And the inconsistent language discordance understanding shows that Sargent's curriculum and students may benefit from additional lessons, especially in the context of language discordance in the therapeutic alliance. And I just want to give a special thanks to my advisor, Professor Laura Driscoll, who's in Sargent College and Kilachand. Thank you.
Congrats, Kaylee, on this project. Just a quick question, not to ask a cliche question about AI, but I'm aware that of the many, let's just say, bad applications of AI, I'm aware that some people in medical fields are actually quite optimistic about what AI could bring to language translation situations in a clinical setting. But I wonder, given that a lot of what you're research focus on is about a therapeutic alliance, relying on empathy, shared decision making, and since we know language transition is about so much more than just words, it's about cultural context. Did any of your participants talk at all about AI, whether they're interested or worried or anything else?
Yeah, I didn't get any specific feedback on AI. However, a lot of the students talked about their experiences with like the iPad translators, and how in their like concern about language discordance, they kind of felt like they were just relying on the iPad, but a lot more goes into it when trying to achieve successful patient care. So yeah, but that is an interesting thought.
I have a quick question. How big was how many applications and how many faculty?
Yeah, thanks for your question. So I interviewed one faculty member per program, so 3 total faculty members, and then the student survey reached about 45 people.
Great presentation and amazing job overall on the project as well. I'm just kind of wondering, as someone who came from a family with limited English speaking ability, so I can appreciate this project a lot. Just what inspired you to do this?
Thanks for your question, Derek. I personally want to go into healthcare. I hope to be a physician assistant, and I also always thought the intersection or how we integrate language into that is really interesting. I'm also a Spanish minor, so I think looking at it from a holistic point of view is always really interesting to me.
All right. Thank you, Kaylee.